My name is Shauna Cowdrey, and this is my poster presentation titled Importance of Nursing History for Nursing 346, Evolution of Professional Nursing. The historical analysis nursing history book that I chose was Making Room in the Clinic, Nurse Practitioners, and the Evolution of Modern Healthcare by Julie Fairman. This book investigates the evolution of the nurse practitioner movement from the 1960s to the mid-1970s. It describes the nurse practitioner movement as a result of nurse-physician collaboration to provide optimum patient care. This book took us through a journey through political, cultural, and theoretical matters and gender dilemmas that outlined the definition, responsibility, and acceptance of nurse practitioners. This book also depicted social, economic, and political issues between the American Medical Association and the American Nursing Association. The nurse practitioner evolution created a significant foundation for health policies, including health maintenance organizations, and improved interest in health awareness, disease prevention, and consumer-based services. History as a pedagogy. The evolution of the nurse practitioner movement provided solid foundation for nursing, as it allowed for continuity as well as growth and change in healthcare, which helped to shape identity. The physicians during this time underutilized their resources, such as nurses, despite physician shortages and threats to the health of many patients. The Bain Committee, which is part of the Surgeon General's Consulting Group on Medical Education, conceded that physicians could not carry out their increasingly complex responsibilities without the collaboration of other health professionals. This helped to shape thinking and allows for the exploration of this highly debatable topic of whether nurse practitioners, whether it's safe for them to practice independently or not. History as evidence. Nurse Joan Linoff describes nurse practitioners as looking for an exam room of their own, essentially a clinical space in which to provide nursing care. This space is indeed a crowded one. Clinical practice undeniably hinges on where and how nurses and physicians work together, but it is also structured by economics, the political circumstances, expectations, and the values of the patient, other providers, and various institutions. It also encompasses much more than getting along, a concept that trivializes the most important aspect of healthcare, the clinical moment when provider and patient enter into a dialogue and a relationship. This quote gave voice and provided the importance of resilient collaboration between physicians and nurses and how imperative it is. Nurses must understand their significance in the healthcare industry and understand that they have potential to help lead transformation of healthcare by taking on advanced roles in providing care management. This provided voice and it helped to dispel myths that nurses did not have a role with physicians, that they were not able to practice independently. As a healthcare industry as a whole, we must shift from a healthcare system that focuses on illness alone to one that prioritizes wellness and prevention. Bringing nurses to the table to collaborate with physicians and practice independently when possible, they can provide wellness and preventative focused evaluations, wellness and health education programs, and also programs that address different risk factors of preventable diseases. These factors have as equal importance as disease-focused clinical interventions that physicians may perform on their own. History as explanation. In the beginning of the 1960s, the shortage of physicians and the influx of patients with medical insurance led to an inconsistent access to medical care. Physicians were in command of healthcare plans at this time, and nurses were only allowed to perform basic skills. and they were not appreciated and or recognized for contribution to healthcare. Nursing's body of knowledge has not been communicated in a way that promotes understanding of the complexity of nurses' work. The danger with this lack of communication is that nurses' work will continue to be invisible and devalued. This quote provides a plan for the future as it lets everyone know, including nurses, that we need to improve our communication and let everyone know that we do make a difference. Nurses will continue to be seen as task-oriented technicians rather than the professionals we are who provide complex care every day. We as nurses must communicate the complexity of the work we do and demonstrate our outstanding contribution to healthcare. And during the 1970s, the evolution of nurse practitioners advanced very rapidly. Understanding nursing history and the events that surround the profession can assist in shaping our understanding of health policy. This progression was made possible through rising public acceptance, policy decisions at the federal level that provided funding for nurse practitioner training programs, and incremental policy changes in state regulations that supported advanced practice for nurses. History ultimately informs policy by showing the value of local entrepreneurial solutions to national healthcare problems. Nurses were encouraged at this time to receive higher education and practice to the full extent of their training. This was something that was much different from the 1960s when there was no motivation for nurses to excel whatsoever. Physicians improving collaboration during this time with nurses also helped with medical care. Patients began receiving more consistent medical care, which led to reduced emergency room visits and hospital admissions. Nurses must utilize their voices to ensure scope of practice barriers are removed so they can continue to practice as independent providers when necessary and able. Nurses can assist with this by communicating with insurance companies, hospitals, and doctors' offices to convey the importance of high-quality, lower-cost care. Looking forward, everyone must understand that nurses have the power to renovate the healthcare system and improve the health of many. Thank you.